My name is Dave Roosh, and I am the Chief of the Division of Hand and Microvascular Surgery, which is a truly integrated division in the sense that we have plastic surgery faculty and a transplant surgeon faculty, as well as orthopedic faculty. It's truly one of the most integrated programs in the country, and in that it is actually a combined effort from the Department of Surgery and the Department of Orthopedics. We're one of the few programs, I think, where we do a lot of elbow cases, from total elbows to elbow arthroscopy, and we do a lot of microvascular surgery as well. So we do elective free vascularized fibula grafts, but we also do free flaps and replants. And I think that makes it truly one of the few programs in the country that does pretty much everything that a hand surgeon would want to be accomplished in doing. Experience lends itself to someone who is going into a tertiary care medical center where you're going to be not only responsible for call issues, but also we emphasize educating residents and fellows as well. One of the things that we pride ourselves on is developing a really close relationship with the fellows. They become a part of our family, really, and that relationship continues into your fellowship year, and you work very closely one-on-one or with the faculty member, and that continues long after you're done. Our former fellows come back once a year for a annual meeting, and that is a great educational weekend for us, as well as an opportunity to get back together with our fellows. Every 3 years we have a Duke Hand Society meeting that's hosted by one of our alumni, and it's held someplace usually international, associated with the International Federation for Hand Surgery. Best part of this, I think, is that you're all on our speed dial, and we're on your speed dial. So you have any questions, anything that you need help with, we're always happy to assist.
I feel very fortunate to be here at Duke. My husband and I are both orthopedic fellows. My husband does foot and ankle. I do the hand fellowship. And so we were looking for a program that would be willing to accommodate 2 fellowships, and also a program that was going to allow me to do the full range of the upper extremity, because I didn't want to just be a elbow to fingertip surgeon, but I wanted to do some shoulder. I'd like to have the experience in shoulder arthroscopy as well as arthroplasty, and so I feel that I have that opportunity here. So we do 2 days of clinic and see anything that comes in the door. Today we had a distal humerus, coronal shield fracture, saw a terrible triad, and so it just depends on clinic assortment that day. I want to graduate from my fellowship not only a very competent surgeon, but a surgeon that has the knowledge to have very realistic conversations with patients, be able to quote the literature, quote the statistics, and feel very confident in the advice I'm giving my patients. And I do feel that that is something that I'm getting here at Duke, because we not only do all of the surgeries, we have this whole gamut of experience, but we're also having very academic conversations as we're doing our clinical experience. I feel like I can make decisions and proceed with a case without feeling like I have to get everything approved by.
And one of the things that I love about hand surgery, which I think all of us love about hand surgery, is that no 2 days are the same. I love that my OR schedule can go from a day of being very small, quick, outpatient type cases that make a very functional difference in a patient's life, like trigger fingers and carpal tunnel, and the next day can be much larger cases and only 1 or 2 cases, but very big. It really runs the whole gamut, and no 2 days are the same. And I think that that's one of the really neat things about this fellowship is when the fellow comes in and we're working together in clinic, we'll indicate patients for surgery, we'll operate on them together, and then we'll have the fortune or the challenge of helping to see them through all the hard times on the post-op side. And that's an aspect of your education that is difficult to get in residency, and we have the opportunity to tailor our fellowship program to make sure that we provide that to our fellows when they come in. One of the things that we pride ourselves on is having a really pretty broad range of of clinical topics that we see and care for here at Duke. So we do quite a bit of elbow trauma, which is one of the things that many hand fellowships don't have a big portion of their clinical care dedicated to, and we do here. So one of the things that we look for is to make sure that the things that we offer match the clinical needs and desires of the applicants. One of the other things that we really look for is someone who values the idea of the family of fellowship and the Duke Hand program the way that we do. The buy-in into the longitudinal aspect of a fellowship, extending beyond that 1 year and having the opportunity to interact, to share ideas, to do that in both a professional and a social and personal side is really one of the things that attracted me to this program, and I think attracts the majority of our fellows.
I think that one of the great aspects of a mentorship model is that you really get to build a relationship. We build trust. We're able to evaluate patients as they would evaluate patients, as well as autonomy in the operating room in terms of how they're doing procedures and allowing us to have that responsibility as well. I think I was a little nervous about the mentorship model with these greats in the field and people who have really become such giants in hand surgery. They're really humble, down-to-earth people, and they really care about your experience, your education, and your well-being. And I think that can be said for pretty much everybody we work with here, which is great.
I was primarily looking for a very broad and well-rounded clinical experience. Was looking for a lot of volume and kind of a breadth of experience and knowledge. Was looking for a place where I could develop as a researcher a little bit around people asking interesting questions with a lot of research support. And thirdly, I think mentorship and the people. I think at the end of the day, you can be anywhere learning hand surgery. For me, it was ultimately about the people that I wanted to surround myself with, both now and in the future as mentors.
And so Duke has a long-standing history of excellence and leadership in hand surgery that started with Dr. Goldner and Dr. Urbanek and continues on today. And we really treat our fellows like they're our junior partners. Of course, our goal is to educate them and help them develop their skills and learn new things. But the interplay, I think, across the board is a unique one in that you really kind of entrust the care of your patients to your fellows, and you really expect them to treat your patients the way that you would. And I think that when you have that symmetric sense of obligation back and forth between the attendings and the fellows, it creates a shared experience and mutual respect that continues on, hopefully, throughout everyone's entire career.
And I do standard of care procedures. I also do my research in hand transplantation. So the fellows will interact with me during calls. They also have surgery schedule and select cases that they are a little bit more interested in doing and a little bit they want a little more experience, so they can come with me and scrub with me in cases. They also participate in the hand transplant procedure, either in the procurement of the limb and throughout the surgery.
I actually did my fellowship at Duke, and the thing that attracted me the most was that this was a fellowship that had a great name and a great reputation, and when you met the people here, they were the type of people that you'd want to spend a year hanging out with, learning from, operating with, and having a good time with. The fellowship took me from somebody who was capable of performing surgery into somebody who was a polished surgeon, ready to do their absolute best work for their patients. There is, I think, a perfect balance of autonomy and learning in this fellowship. The expectation is that people come here to learn how to be a hand surgeon, not to start over their residency. So we're expecting to teach you how to operate and operate at a high level, and then to watch you operate at a high level. And it's graduated, so you don't feel like when you get here that you're just cut loose and expected to be able to do this all on your own. You always have your safety net of somebody there to help you through it.
Oh, the hand fellowship's amazing. We have great faculty here who are totally invested in all the fellows. It's a priority for the division for fellow education. They're really the center of our whole division, the lifeblood. We try and make it a complete fellowship with the priority of their education and prepare them the best they possibly can to get into the world and be successful. It's interesting, right? So we initially come in as trainees, and the fellows always leave as friends and colleagues, and that's over the course of the year how much time we all spend together and the leadership of the division. We develop really close relationships, and they're lifelong friendships.
To live here, and honestly I came here because the fellowship was so good that I would live anywhere to come to Duke and do a fellowship. When we got here, it turned out we actually really loved it. We love living here. The weather is great, the cities are great, the people are great. It's a really nice place to live. It's a really nice place to raise a family. It's a great place to spend a year. I think the neat thing about the triangle is it's truly a triangle. You have 3 different cities and 3 different places that you can spend time. We have our eclectic, urban, hipster city in Durham. We have our corporate white-collar city in Raleigh, and we have our southern college town in Chapel Hill, and they all have cool, different things to offer, great restaurants, great shops, great things to do. We really fell in love with it.
And then you're only about 2 hours from the coast and equidistant from the mountains, and we have really incredible opportunities for many of the aspects of life outside of the hospital, such as food, arts, sports. We've got great college sports here. We've got Durham Bulls and AAA baseball. We've got a lot of opportunities for whatever your preferences are for your personal satisfaction outside of the work environment.
Welcome to Duke. I'm Coach Mike Krzyzewski of the Duke men's basketball team, and I've been here for 40 years. So we have had an amazing relationship with the orthopedic team. They are there for us all the time. And for me personally, I have 2 hip replacements, 2 knee replacements, and it's all gone well. They make us better. They make us better because we're good and they're really good. And when you come, you'll get trained at the highest level. There's an education there that we will do to the highest level also. We will allow you to make us better while Duke is making you better. That's the way it is, and that's why you should come. I'm sorry you're not going to be here in person, but hopefully I'll be able to see you here in the future.